So now how exactly do we evaluate for sleep disorders? Many times we do it with a sleep study. What a sleep study is, it's a test that takes a look at a lot of different variables during the evening. Polysomnogram is a sleep study. Poly means many, som, sleep, gram or graphy is the recording of. So we do take a look at a number of different variables during the evening. One of the things that we're looking for is for obstructive sleep apnea. Now, normally, as we're sleeping, you have plenty of room for the air to flow. And on this polysomnogram, you can see right here when we're taking a look at the chest and the abdomen, we're looking for effort. And you can see that this person is trying to breathe, that the effort is there, but the airflow, there's less airflow. And when there's less airflow, either oxygen can come down or it can arouse us or wake us up, make us wake up more than what's frequent. And this can happen multiple times during the evening. Now in children, the majority of obstructive sleep apnea actually is from tonsils and adenoids. However, about 2 to 3% of children have obstructive sleep apnea, as opposed to about 10%, 9 to 10% of children have something called primary snoring, which means that they are snoring, but the snoring is not causing oxygen to come down, or it's not causing brain to be activated or disrupted during sleep. So what I say is, you don't just get your appendix taken out. If you have an appendicitis, then you get it taken out. And a sleep study helps tell in a child if they have snoring that is from sleep apnea or snoring that over time they may get exposed to less germs, the tonsillar and adenoidal tissue may shrink, and as you grow, the airway may mature as well. So there is a chance that sometimes we can outgrow the snoring. You have to remember that the tonsils and adenoids actually do have a function as well. In adults, it's a different space. It's the retropharyngeal, or in the back of the throat area, that is the site for most obstruction. It's actually one of the reasons why a lot of the nasal strips that you buy don't necessarily fix the issue, because it doesn't address the one area that is mostly obstructed during the evening. Now, there's a lot of different treatments for obstructive sleep apnea, and we did talk about tonsils and adenoids for children. There's a lot of different modalities, but for the purpose of this, what we're going to do is we're going to show you what CPAP is. CPAP is continuous positive airway pressure, and pressure is the main word there. It's the pressure that holds your airway open. The best example that I can give is, let's say you go to a nursery and you buy a tree, and you plant the tree, and the little Charlie Brown Christmas tree sometimes has a tendency to fall. Now you put a stick in the ground and you tie the tree and you've splinted it, and now that tree is upright. Well, the pressure in CPAP splints your airway all the way around and holds your airway open. And here's just an example of what the pressure does to our airway. And you can see that as we increase the pressure, that the diameter of the airway, or our airway space, increases and it holds it open. Now, the majority of the times when we're evaluating for sleep apnea, we end up getting CPAP. It's a two-step process. First, you do a sleep study to see if you have sleep apnea or not. Then we actually do a different sleep study that we give different pressures during the evening to be able to find out what is exactly the right pressure that holds our airway open. Too small is not going to really help, but too much may be a little bit uncomfortable to tolerate. Now, here's an example of someone who has a untreated sleep apnea. One of the things that you see is less of the oxygen desaturations. You see less sleep fragmentation, less brokenness of the sleep. Another thing that you see is a lot more REM. And early on, there was not a lot of REM in that first sleep study, especially in the beginning. And then when you give the CPAP, they get all of this REM sleep, and that actually has a name. It's called REM rebound. And you also have a lot more of the non-REM and even more of that deep sleep. Right off that, you can see how this can help with both learning with short-term and long-term memory processing when you have an untreated sleep apnea and then you treat it. You also see here less snoring and overall less of the apneas that we showed earlier. One of the things that's important is that we do this study where we give the different pressures, because even though at the beginning of the night it looks nice that you have more of these REM rebounds, you still have some of these oxygen desaturations that are coming, or apneas, and then you find the right pressure and bam, you eliminate all of the the snoring and the oxygen desaturations, and you have better sleep consolidation. Now, one thing that's important is this sleep study that I showed here, this patient actually came to me for insomnia. They said that they weren't sleeping and they tried multiple sleep meds. And what was happening is that they had such brokenness to their sleep that they perceived that they were not sleeping and they were tired the next day. However, once we started treatment with the CPAP, that actually fixed what the patient had perceived as insomnia.